Hello everyone, we are here again with another session on Rehabilitation Sciences Group, and today we have a very eminent physiotherapist, Dr. K.M. Annamalai sir, and he'll be taking to a introduction to KCAT, what he has done, and we have Dr. Sagun Agrawal. He will be introducing formally Dr. K.M. Annamalai sir. Dr. Sagun, please.
Good evening, everybody. Welcome to Rehabilitation Science Group. We are privileged to have Dr. K.M. Annamalai sir on our group. Sir is Secretary of Indian Association of Physiotherapists. Sir is Chancellor in Gandhi Gram Rural Institute under Government of India, Ministry of MHRD. It's a proud moment that our physiotherapist is on a Chancellor post is there. So it's a proud moment for all of us. Sir is Head of Department in Department of Physiotherapy of Apollo Hospital, Ahmedabad. Along with this, Sir has got the Oxford Blue Ribbon Award as scientist for the founder of the KCAT. Along with this, Scottish Award from UK, and we feel proud that Sir has gotten numerous awards and all the things in their life. So I would wish all the physiotherapists should follow his path. Thank you, sir. Thank you for coming on this platform.
So, thank you, Shagun sir. Thank you, Dharam sir. You are doing a great job during this COVID time. Actually, there is a lot of problem is going on everywhere. COVID. During this panicity, you are just working a very beautiful way that actually what you can say, everybody is in trouble. So but during this time we are looking for an opportunity for a learning, and you are creating with a long vision to create a wholesome library of beautiful the talks, and it is going to definitely serve the purpose of the society, and it is really one of the amazing effort. First of all, I would like to congratulate the team of this rehabilitation series. I'm very happy to be the part of this, and myself has started this KCAT journey just 12 years before. I'm just basically myself as a cardiopulmonary critical care physiotherapist. Till date, I'm working in ICU, but initial days I was not much having fond of musculoskeletal, because for one damn reason, I was getting a lot of gratification and a lot of happiness and a lot of joy and proud and everything be a cardiopulmonary physiotherapist. The reason behind is it's an evidence-based practice. When I go to ICU, I can auscultate. Once in auscultation, if I get some crepitus or some sounds, so immediately I work on them, or if there is a rails or rhonchi or V's, I work out on them. So I can immediately post physiotherapy if I just do again the auscultation noise become beautiful. It become a normal. So that give more enthusiasm, or what you can call it as a feedback mechanism to improve myself. And moreover, I can show the changes in ABG. I can show the changes in chest X-rays. I can show the changes in, I am also one of the reasons for contributing to change the mode of ventilator to patient to wean off. So all these things are given me a lot of pleasure in that way. So during that moment in the life, whenever it was going smoothly, even that time I used to work like this. If some patients come for some other problems, I refer them to the therapist who is working on that musculoskeletal neurological part. I focus only on critical care. This was a time. So during that moment, in my hospital, in ICU per day, in case of cardiac ICU, per day, CTOT, the cardiothoracic surgery, median sternotomy will happen 8 patients per day. So then next day, this 8 patient will go to step down ICU, then next day 8 will come. So I was keep on working. In between, if they have any shoulder problem or knee problem or ankle problem, I'll refer them to the one of my colleague or some other colleague who is working for the musculoskeletal areas. So this was my practice all about. The change was a patient. A patient always a good book, I believe, and patient is always a good teacher, and patient will teach you everything, and you want to be a good professional, your clients are the good teachers. I believe in it. In such a way, a patient was very adamant that I have to treat his shoulder. Honestly, I said that I don't treat your shoulder, I treat your chest. So he said, no, sir, you have to treat me. Okay, fine. So I took that challenge. So I worked on the shoulder, but I didn't give good result on him. So he feel that, sir, you can do it, you have to do it. So I said, see, honestly, I work on your chest. I can show you your changes in X-ray and I can show change in your ABG and I can give a better auscultation sound. I can make you wean off very fast. I can be a contribution to that area. He said, no, sir, my shoulder problem also you have to sort out. Then what I did, as usual, I did it. Then later on, it has been knocked throughout my life that I have to do something for this. So what I decided means I started to work little bit of musculoskeletal work on that note because most of the sternotomy patient will have a shoulder problem. So initially, I love one joint called shoulder in musculoskeletal. I work fully on musculoskeletal on shoulder joint, shoulder joint, shoulder joint. So around one time, 7 to 8 patients in my full lot of that 20 patients are having a shoulder problem. So in that 2 to 3 patients, what I do means I just regularly doing all the exercises. I do prophylactic ke liye, I just start to do, instead of low dose heparin, we used to work ankle pump exercise for prophylaxis. So I used to do that exercise for that patient. The one day this patient, when I do, the patient was having a shoulder movement this much only on the right side, on his right side. So I was just doing a left ankle pump. After 10 seconds or 15 seconds, he suddenly spontaneously lift the hand. It went up. So I said, sir, what you did? It's a magic. I said, I don't want to show that. I don't know. Then always I want to be pleasure to enjoy that actually the credits. Yeah, I know I'll do the same thing like that. So that has given me a struck that what is the relation. So that has make me to think I should learn more about anatomy, how it connected. So what is a connection? Where is a missing link? So I search our anatomy books. So that time I came to an idea that whatever anatomy books we are reading, all the anatomy books are talking about 2 dimensions. It's not talking about 3 dimension because our organs are fortunately 3 dimensions and it is not 2 dimensions. And we are therapists. We are not a physicians to write with pen and paper. We are therapists. We have to hold the organs. We have to play with the organs. We have to work on the organs. And I have to mobilize the organs. I have to motilize the organs. I have to use the organs in a better way. I have to manipulate it. So all these things I should, if I want to hold the organ, I should know the 3 dimension of that organ. If I want to hold a body part, I should know the 3 dimension vision of that. What is going on inside in a 3 dimension way. So unfortunately, all our investigation systems like MRI, CT scan, and everything is 2 dimension X-ray. But only thing is, I found out the sonography is a 3 dimension. So for KCAT, I just took the sonography as the strongest evidence for KCAT. So this is an idea all about how the KCAT. And moreover, then I started to work out that we read anatomy on dead bodies. So normally in dissections. So in the dead bodies are lying and they are in elimination of gravity where we are doing a lot of dissections and we are learning the organs and we are learning dead bodies of the dead tissue where all the package materials fascia has been off. So we are not actually working on the original body, actually functional body. We are working in a dead body and that too in a lying position. We are trying to learn all the structures, anatomical and physiological structures by means of a dead body or dead tissue or by decayed tissue, same time without the influence of gravity. But we are working throughout the day, activities of daily living is in anti-gravity. So in anti-gravity, all the organs are hanging in trees like a branches. So that the impact and the effects and their functional, everything is different. So in KCAT, I decided that, okay, I want to learn the anatomy. I want to teach the anatomy. I want to work on the anatomy of 3 dimension of the functional movements of the functional anatomy and functionally what it is, you take it as it is. So that way, the idea has been started to conceiving of KCAT. So I would like to share with you the slides. Okay. So first of all, I would like to say what is KCAT. What is KCAT? I think everybody can able to see my slides.
Yes, sir. Go ahead.
Yeah. What is KCAT? It is an interface of physics, maths, biology of movement science. So basic science after 12th standard, what we are reading, that is the basics of life. Physics, maths, and biology of movement science. I love maths from the beginning. I was actually a 6 months of engineering student. Then I just got into physiotherapy. So one of the subject which I love maths. So because maths is I love because it is the only subject in the world that speaks about accuracy rather than approximation. Because I feel that the maths, the science without maths is grammar without language. So the maths is a backbone. So KCAT is a first, and I can just proudly say that one of the best mathematical model of movement science. Not yet mathematical movement science has been started yet. So I'm so happy to announce myself that KCAT is a mathematical model, and it is a physical model and mathematical model. Same time, it's a biological model of movement science. It consists of innovative principles, concepts, algorithm, formulas to reshape the human dysfunction, movement dysfunction to normalcy. Whatever movement is getting locked, that movement can be re-executed. And I created a lot of algorithms, formulas, concepts, and principles. That's why I said it is a mathematical model. So the KCAT is workout are based on fascia science, Newtonian physics, metaphysics, evolutionary biology. These are all the areas inculcated into KCAT. And it is very effective in patients with movement dysfunctions due to physical or emotional illness. So it is a complete package, the physical as well as it can work in emotional level. So physical or emotional illness. It is non-chemical intervention externally. So we are not going to use any drug. So that's all about KCAT definition. How the KCAT idea was conceived. So there is a, I already talked that it is a two-dimensional, it's not a two-dimensional idea of regular movement science. It's a three-dimensional vision. And it is more of structural to functional. Why the structure developed for this function or function has developed this structure. So that means if wind comes, so the tree is moving, or tree is moving because of that wind is coming. So that's why the structural to functional, functional to structural. That correlation has been very clear with the KCAT because it's a three-dimensional anatomy. And embryology to gerontology. So we can do an intervention from embryology level to gerontology with this science. And it is a micro to macro movements. Whatever I'm just moving my hands and legs and everything, it's a macro movements. What is micro movements? The micro movements are my motility. It's a stomach is doing a peristalsis motility, heart is moving, continuous contraction, and my lungs are keep on expanding and closing, expanding and closing. My kidneys keep on moving along with the diaphragm. So all these things are motility, which is motile. It is a micro level movements, which even cannot be identified through sonography. There is a micro movements are available. Nobody can deny the facts. So it is actually, it is a embryology to gerontology, micro to macro movements. And it is a unicellular to multicellular evolution. So actually evolution started from unicellular to right now Homo sapien, we are multicellular. So it is going to talk about unicellular behavior pattern to multicellular behavior pattern. And present tense to past tense. So we have a time machine management. With that, what we are going to do means what is your present problem is because of your past karma. So we are going to take the past tense. And from the past tense, we are going to predict your future tense, what will be happen. So this is going to be doing a cyclic of physics. So I told that it is a combination of 4 subjects. KCAT is a part of facial movement science. You know, I'll discuss fascia later on. And it is a part of Newtonian physics. It's going to talk about a lot about gravity and inertia and all those things, which is an instrument. And it is a part of metaphysics, which is an advanced level we are going to talk. That's why I said it is connected emotionally. And it is a part of evolutionary biology. So why we are taking evolutionary biology means the movements are growing, and the skills are growing, which is evolutionary. The anatomy is also changing. So we have to accept that anatomies keep on changing. You can see that the first anatomy of 4 legs and partial 2 leg and full leg and Homo sapiens with bipedal, and now the bipedal is can run like anything. So running machine. So all these things are the movements are keep on changing. Movements are keep on changing because anatomy is changing, physiology is changing. Physiology is changing, anatomy is changing. So that's why KCAT is a part of evolutionary biology. And how did I inspired with this KCAT? First inspiration I was took because our honorable Prime Minister always insists to do make in India, make in India, make in India. So this is one of my inspiration because I want to do something make in India, made for India, made in India. So I got inspirations from traditional indigenous method of movement science like Siddha, Yoga, Tirumular Tirumandram, Rigveda, Tolkapiyam, Marma. These are all few Tamil scripts as well as Sanskrit scripts. The Western medicine, functional anatomy and structural physiology, and physics and evolutionary biology. All these things inspired me to create this concept of KCAT. Okay. Where and all we can do an intervention effectively in KCAT. So this is a simple cycle of KCAT. So where and all you can do an effective intervention. Disuse or misuse. Disuse means I'm not using my body, I'm so lazy bug. So it's a disuse. Misuse means unaccustomed activity, I'm doing exaggerated activity, that's a misuse. So both of them are not good for body. Threshold is always best. So there is a disuse or misuse, it results in injury because it's going beyond its limits. So injury leads to a mental level and physical level little bit of immobility because of early fatigueness. So you don't immobile, you don't be mobile much. So immobility results in adhesions. Adhesions leads to dysfunction. Dysfunction means you don't do function properly. So when dysfunction is prolonged for a period, you will get into habituate dysfunction is called deformity. Once a deformity comes, then you are getting into the spectrum. Welcome to the new disease called NEXYZ. For example, knee dysfunction leads to osteoarthritis disease. So once a disease comes, you'll get depressed. Oh my God, I got early changes in arthritic changes. Oh, it's a depression. So the psychological depression will again results in disuse, misuse. So this is called a KCAT cycle. So this cycle, intervention can be done any place effectively with this technique. If you are the phase between disuse, misuse and injury, you can use KCAT. And if you are between injury and immobility, you can use KCAT. Immobility and adhesion, you can use KCAT. Adhesion dysfunction, you can use KCAT. Dysfunction deformity, you can use KCAT. Deformity disease, you can use KCAT. And disease and depression, you can use KCAT. And depression and disuse, misuse, again, you can use KCAT. So KCAT can be intervention effectively in between this all 8 chakras. Wherever you want, the 9th technique is KCAT can be effectively intervention. You can do it in all these 8 places. What are the 10 concepts of KCAT? So I'm going to talk volumes of KCAT in first module is about the concepts, because if you understand the concepts, you can use the algorithm. And algorithm, based on algorithm, you can do a mathematical and come out with a diagnosis and treatment. So 10 concepts of KCAT. Sensory input is equal to motor output. So wherever you give a sensory input, there is definitely a motor output. So it is actually a common sense is cause effect mechanism. And good and bad sensory. Good sensory, good movement, bad sensory, bad movement. And third one is a root cause analysis. I'm not going to use diagnosis or differential diagnosis. For that, why I'm not going to use, I'll explain in my workshop, but I'm going to use the word called root cause analysis. And instead of range of motion, I'm going to use range of movement. There is a lot of reason and there is a lot of research. And evidence informed practice instead of evidence based practice. And evidence informed practice is, again, I should talk in volumes, because evidence informed practice help me to understand better results for the evidence based practice, because evidence based practice are predetermined ideas and pre-expectation, and I will do a hallucination and I'll come out with that own idea and I'll come out try to prove that my expectation. But evidence informed practice is a multi-level, because you cannot expect any result. The results will come, that will guide you, that force will guide you. So always believe that evidence informed practice is more powerful than evidence based practice. At this time, we can able to understand during COVID time how much the bias is going on in the world. And next is Newtonian physics. So it's lot and lot talk about Newtonian physics, about the gravity and inertia. And next is fascia study. Yeah, I'm going to, without fascia, nothing, I'm going to talk much about it. The fascia is a huge area. I'm going to touch a little bit in the future. And time machine management, that is other again a mechanics of physics. And no lotion, no action, and mobility stability. So these are all the 10 concepts of KCAT. So in nutshell, if you want to understand what is KCAT means, the ultimate aim of this KCAT is science to improve mobility and motility with a feeling of pain-free universe in the sedentary infectious era. So what I actually previously it was sedentary, but after COVID I understood I should not miss the spectrum of infection. So it is a sedentary infectious era without the help of pharma molecules. I want to break the chain through the KCAT. So why it is a revolutionary concept? Because I told the KCAT is a strong evidence-informed practice. So what is the difference between evidence-based and evidence-informed practice? Evidence-based practice, a common people or common public cannot be able to understand your evidence base. For example, you have a MRI changes or you have a ONE changes or whatever it may be. That you can identify, a doctor can see, but a normal human being. So why I just believe that every patient should create the awareness of what is going on in the body. It is their right. So how we can define beautifully. So how much we are making them to understand, that much the system of belief will start to create a strong bond between a physiotherapist and a patient. So that will help you to grow you like a field like anything. So that's a reason. So here, suppose a patient is coming inside, a simple 2-dimension photo or 3-dimension video you take and do some movements and you just do it, and 10 minutes or 15 minutes you assess and create your algorithm. Based on that, you diagnosis and what is the treatment method, you take that and work on that patient. Then again you take a video or photo, then both a photo and video in 15 minutes you compare and contrast and show to the patient. The patient also will feel so happy because feedback mechanism, biofeedback mechanism, same time patients start to believe it and patient will start to market for you, and really you're doing a great job to them actually. Rather than changes in MRI and X-ray, if could patient change, if the patient himself change, that makes a great volumes. It speaks, your work will speaks in volumes. So that's the way we have a evidence-informed practice. There are different fascias in the body. You know that a lot of people know nowadays fascia is what again, movement science. Without fascia there is no movement science. So there are a lot of fascias, you know, epicranial fascias in the head and plantar fascia, and you have a thoracolumbar fascia, and iliotibial band is having a IT band fascia. All these fascias having a different nature, different physiology, and different anatomy and different functions. All the fascias are not same. Okay, how the fascias? There are superficial fascia and deep fascia. Any muscle which is covered by epimysium, and if you take a muscle and split into muscles into small areas, then it is called muscle fibers or bundles. So these bundles are covered by perimysium, and again the perimysium is covered, the muscle fibrils which is covered by endomysium, and endomysium inside the myofibrils. So what happens means all these three mysiums are called internal fascia, which helps to sliding the muscles beautifully without struck. So this is called deep fascia. What is superficial fascia means? The muscle is completely covered, and below the skin there is adipose tissue, and after that you have a layer called fascia, superficial fascia. And here I want to show a photo that this photo explains that the epimysium is only a continuation of tendon only. It is not a new tissue, it's a part of tendon. But modified tendon is an epimysium. So tendon is also a fascia, which is a strong fascia with a different physiology which is connected to the bone. But here I want to say one more joke that bone is also once upon a time fascia, and due to the force it become cortical. So this is all is a fascia about it. That it's affair of fascia, epimysium, and all are deep fascias. And what is superficial fascia? So I can show this fascia. Why I took sonography as evidence? Because the no Western medicine won't understand the evidence-informed practice. They say that it is indigenous medicine of practice or Oriental medicine, or it is a holistic approach. But I don't want. I want to break their concept also. So I want to go with the sonography evidence. So I have a sonography evidence. So how to look into fascia? This is a skin. So here I'm next slide. Next nearby I've given a sonography evidence. I've given a microscopic evidence too. So you can see the skin, and after the skin you have a superficial adipose tissue, and here also superficial adipose tissue, and below that you can see that it is a superficial fascia, and after the deep adipose tissue, and after that you have a multi-layered deep fascias, that is epimysium, perimysium, endomysium, and below you have a loose connective tissue and muscles are there. So basically this is the structure what you can see in the this thing sonography, as well as this functionally you can look into it, because during the function you can see the sonography as a movement science, as well as you can see microscopic evidence. What is the contents of fascia? Fascia contain elastin, collagen, ground substance, and water. So you know that what is elastin, what is collagen, what is ground substance, and water. Anyway, I'll explain you on the last part. And you know that the KCAT have a different connections. I inspired all these connections from Tom Mayer anatomy trains. And you have, these are all the evidence created by him, because if I want to speak about gravity, I cannot find out gravity. Science is basically getting the science from others, and we have to make your own science. So like that, the head to toe, you have a connection that actually you have a epicranial fascia and occipital protuberance, and it is just continues as a paraspinal area, and it is going towards a sacrotuberous ligament, and again it is continuing as your hamstring fascia, and after the hamstring fascia it is going to a calf fascia, then it is going to be a TA tendon, and then it is going to be a plantar fascia. It is basically a continuation model. So this area we are using for a mathematical sum approach, and we are trying to use for diagnosis. So I just this is my this thing. So this is actually just an orientation. I'm not talking much about it. Now I will show you few tips and few ideas that how you can just execute it. Few techniques I can show you. So you'll be enjoying that. Yeah. Okay. So now what I'm going to show you means, see, look at here, clay. So this is basically an elastin. So what is elastin means? The elastin is something like, it is working under the Hooke's law, that is stress by strain. So stress by strain means when you just stretch it, what is happening means it is undergoing stress. Again, it is coming back because it has a strain on it. It has completed it. It is coming back. So what is actually happening? Stress by strain. So it is actually deforming and reforming, deforming and reforming. If any tissue is having ability to deforming and it come back to the original position of reforming, then it is called elasticity. And what is called as that elasticity, and that is done by elastin. And what is the other part is called, you may know that actually it has a collagen. Collagen, the beauty is, I'm just taking a small amount of clay. I want to stretch the clay. It is stretching, 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 stretching. A particular limit, it can go for a plasticity. After plasticity, it won't come back. It may come back after many years, but if doesn't know mechanical work, it won't come back. But if you are going to get at one point of time, it leave it. So it loses fibers. So collagen is something like a structural tissue which has a less elasticity and more plasticity, and that's about the collagen. So when this collagen and elastins will combine to form a ground substance, and this ground substance are inside the fluid of 70% of water, because the ground substance help to be nourishment and nutrition, and whereas the water, basically it is just coming inside the water, which is 70%, which is inside the body, which is going to function for a grease in the machine, like friction free. So that's why the hydration is a very, very important role. So the fascia is a combination of ground substance or your water, or it is going to be elastin or collagen. All these four factors, all these four factors can be modified or influenced, and factors can be regulated. And the second point I would like to say is, I have a beautiful part of coconut. So you can see this coconut. This is a tendon basically. So this tendon is just attached to this bony part. So this tendon is attached to bony part by means of a different facial layers. And this is basically a superficial, this is actually a deep fascia of epimysium. And this tendon is a part of epimysium. That's why I want to say tendon is the strongest part, and this is a very mild part, and this is a bony part. So if there is any fracture or something, you can get avulsion fracture along with the bone shape that is happening because this is a part of this that's inculcated into it. Now I want to show something else. The fascia is beautifully a three-dimensional structure. What we are seeing, the dimension, something like it is moving in a two-dimension, it won't move like that. The fascia will just move in all the directions. So I want to show this. This is a beautiful example. Always I show. This is coming with a wine bottle, or it is coming with this, what you can call it as kind of fruits. So this is nothing but fascia. So now I want to move the fascia. I'm just moving the hand. So when I move the hand, or when I move the hand, the fascia is moving in all the direction. Fascia is moving in all the direction. So again, I'm saying that when fascia is moving in all the direction, so that means the muscles and organs are moving in 3 dimension. So that's why I said the anatomy is 3 dimension. It is not 2 dimension, which is the main focus of KCAT. And apart from this, I want to show you a few things like I'll show something interesting. So what you can do means you can take the 2 fingers, tape, and just keep it palpate simply in protuberance, occipital protuberance, and just close your eyes and try to move the eyeball on side to side, side to side, side to side. You can feel the palpation over here. Rectus capitis muscle will start to contract. So how you are moving an eyeball, the rectus capitis muscle is trying to move because there is a connection called epicranial fascia. So the fascia is activated. So similarly, when I move like this, I can have a mild changes in my eyes. So most of the tension headache, most of the cervicogenic headache, and most of the there is a bifocal length or something like kind of diplopia. All these things are maybe there is a struck of rectus capitis area of the fascia, or in between the facial connection has been disrupted. So this area and vertigo and the vertigo sometimes without any benign vertigos. All these things there must be a reason. So there are a lot of clinical interpretations are there for each and everything. So this is a simple example of fascia. And one more simple idea I can give you, because in the sitting screen I cannot explain you much on something to show like that how what we can do is. So but a few things I can show you. Okay, now the simple thing is the fascia is not only covering the muscles, not only covering your, it is actually a packing material which is covering your organs too. So basically, when you organ, you inflate inside or outside, anyway, it is going to have an impact on fascia. The fascia may be in the form of peritoneum is your fascia, pleura is a fascia, and pericardium is a fascia. All these things are covering layer of the organs. All the renal capsule is a fascia. So all the covering organs are nothing but fascia. So all these fascias are interconnected, and they are interconnected, and 3 dimensionally they are intra-connected with the external surface of your skin and superficial fascia and adipose tissue. All these connections, once you get connected properly and you can create a beautiful mathematical model, that's all about KCAT. And now I want to show you my beautiful example. I love to show this example. I got this toy. So this toy, if you see, what you can see means, I want to show you a tensegrity model. So what is tensegrity model means? The model, the integration of tension will keep you to maintain your posture. Integration of tension. Suppose there is a pole. This pole is connected on both sides with some strings or some elastic tubings. This side also you have elastic tubings. So now this pole is standing. Niche I'm not giving, in the down we are not giving any support. But this is standing because equally it is pulling. So when an equal force is pulling, the pole is not at rest. Pole is actually counterbalancing the force between the 2 segments. So it is maintaining the straight. Alignment is maintained properly. So now when I disturb one side, it bend on this side. When I disturb other side, it go on the other side. So if I just disturb on this side, it will go other side, because which is more stronger contraction. So, but this pole is maintained. So our body is maintained. See, I understand that you call that bone is a framework of the body. 50% I can agree. 50% I won't agree, because the bone is contributing only 50% of your framework. That framework is kept in the space, in the position by means of tension maintained by the fascia. That's called tensegrity model. So what I want to say means, you see this toy is actually with the tension wires, it is maintained properly. So now I'm going to cut the wire of the tension. So how it is going to collapse? It got collapsed. So now again, I'm just going to connect the wires. So it is going to stand up. So this is all about tensegrity. So I think the time which was given with that, I did a reasonably small amount of introduction of KCAT. So from here, I'm just thanks for the opportunity provided. Now I'm going for a question times. You can ask any question if you want.
Thank you, sir, for such a wonderful lecture.
Thank you, sir.
And I think the audience has like, it is a very unique concept, and interrelation between the new science and old science. It is really wonderful to see that lecture. And um, what kind of diseases we can treat with this KCAT model, sir? Like, basically it is based on fascia. So any like pathological changes, if like you said, osteoarthritis, a kind of thing. So can we treat all those with these techniques?
Yes, sir. So basically, I say that the concealed effect of any disease is a dysfunction. Suppose in the daytime we are seeing the sun. It is not mandatory that there is no moon. Moon is there always,
Yeah.
but sun is brighter than the moon.
Yes.
So, but moon is there in the night where the sun is not working.
Yes.
So basically, like that only, the disease and dysfunction are the two sides of the coins. So whenever the dysfunction starts, slowly, the dysfunction is a milder form of disease. So dysfunction results in disease. That the KCAT is believing very strongly.
Yes.
So what we can do means, if we just relieve the dysfunction, so there is a huge changes in the disease spectrum. So because the dysfunction only leads to disease. So that's why I go through root cause analysis.
Exactly, exactly. Dr. Sagun, you are here. If you have anything in mind.
Sir, very nicely explained, sir. And that toys is starting up from the rubber balloon to then the clay, and then with your that coconut part. Really, it is interesting. और हम students को अगर जो समझाना चाहते हैं ना, definitely that's the model. ये आपके टीचिंग मेथोडोलॉजी से ही समझ में आता है कि सर हाँ, कि सीनियरिटी से ये सीखना है कि कैसे बच्चों के अंदर पूरा ब्रेन के अंदर पहुंचा सकें कि कैसे चीजें होती हैं. सर हम ये चाहेंगे सर, इसकी है ना सर, थोड़ी सी सीरीज में अगर हो, कि आज तो बिल्कुल इंट्रोडक्शन था, ऐसी कुछ फ्यू, जैसे सबसे कॉमन है फ्रोजन शोल्डर है, तो वो बहुत कॉमनली आपने देखा कि इसी वजह से, जैसे आपने कहा भी कि शोल्डर से शुरू किया था. तो मैं चाहूंगा सर कि आप इस तरीके से थोड़ा सा इफ स्टूडेंट्स को देना शुरू करें कि कैसे, हाउ टू सॉल्व दिस प्रॉब्लम. ओके, तो दैट वुड बी बेनिफिशियल फॉर ऑल ऑफ अस.
Sir, actually for shoulder, I have a specific technique on patent on my name, is called a finger fanning technique.
Okay.
So what is this finger fanning technique means? If you go through our principles, the 10 principles, and when I go in depth of one by one, in that you will understand that exactly how the mechanism works. But in simple way, you to understand in a simple part, I can give you a small synonyms. Suppose, for example, there is a light. So this light is not ignited, which is not working properly. Unfortunately, the Western medicine teaches beat around the bush of that light and light holder again and again. We'll change the light, or we'll work on that around. But here, what is my concept means, where the light is problem, the switch is somewhere around. The switch is not inside the light always. Because the God has given beautifully that it is not easy to access if it is kept inside only. So always the switch is somewhere else, whereas the light is it's an indicator. So when indicator is not working, you have to look for a switches. So you have to work at the switches or wire, then you should change the bulb. You cannot directly go and change the bulb. So the surgery is something like directly changing the bulb. You got the idea? Whereas our physiotherapy is fortunate enough to understand that we can go in depth to the light and the wiring and switch, because that is called root cause analysis. Where is a default? So suppose, for example, I have to take a shoulder. The first patient which I see, which has given me enthusiasm to understand more into musculoskeletal, I work on the opposite foot, whereas his shoulder has been, range has increased. I never expected that result, but after that I took the credit of the result by the namesake that it came. So I was doing that. So I have to take it. So I took it and I was enjoying that. So always. So what is exactly? So that time I was not understanding because I went and read the anatomy books. That time I have the understanding that I'm not a musculoskeletal therapist, so I do not know. Normally, see, this is a normal mentality of any clinician who is working focused on particular work. Morning to night, I'm working on chest, 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 chest. Who will understand that what is going to happen in this? So I spoke to many musculoskeletal therapists. They gave the reference of Tidy's book and all those things those days. So I used to, because internet is not much, so we used to read Tidy's and all those things. And who our friends we used to call, and they said that, see, it may be a psychological, it may be hysterical sign. That's why he got moved. It is nothing relevant to your foot. Like that, it was going on. So that time I just, I think this taping was beginning. It is, I think, in 2012 or something, taping beginning time. So there is a German friend who came all the way and he was just discussing with me that actually there is a concept called taping and all those things. So I was just relevant to that, and then I spoke. Then he introduced this Tom Mayer. So when I see the Tom Mayer, I read that there is a relations, but that time I don't understand what is inside. So when I read and read and read, I don't understand. So then just that's it. But when I just start to function when I start to read a lot of this literatures of Tamil and Sanskrit literatures, there also it is mentioned that where is a pain, there is no relevance to the problem. Always problem is somewhere, the effect is over there. The cause effect method. Even it is in Bhagavad Gita that cause effect is something that's called karma. So cause effect, cause effect, cause effect ke dimag mein aa gaya. So once a cause effect comes, then I want to find out why it is happening, why it is happening. So then I decided that, okay, so most of the shoulder problems, if you take shoulder problem, shoulder is basically, shoulder is once upon a time, it was a lower limb, evolution wise. Because we walked on crawling on four limbs. When my childhood, I crawled, creeping, I was done. So once upon a time, I used this as a upper limb, as a lower limb only. And my grandfathers and grandfathers are my era, the all lions and tigers, they walked on four legs only. So this was basically a limb. It's a limb of a lower limb. So its function is lower limb. But recently the evolution has changed myself for a few thousand years that I don't want to use this because I work against gravity. So when I start to work against gravity, my body totally, so I decided that all the trunk muscles which was supported before, when I was crawling or creeping or when I'm walking with four legs as a quadrupeds, that has become anti-gravity function now. They are actually elimination of gravity method that has been transformed to anti-gravity function. So then I decided that I work on trunk to clear my shoulders. That was being done for a few days, few years. And after that, suddenly I start to prove that it is wrong. Because I didn't get results in few patients. Then I decided that my fingers are the king to create a good thing to my shoulders. So then I decided that the entire structure, the model has to be calculated in a meticulous way with the mathematics. Sometimes the distal will be the reason for the proximal problem. Proximal may be the problem for the distal problem, or center may be the problem for proximal and distal. So this idea I came to an existence. So with that, I'm just treating this.
Thank you, sir. Thank you. With the simple words, you have told us, Kiminski, you have to find the problem, you have to find the cause, and then you have to treat it. And
Yes.
both things won't be on the same place. And sir, but in the last, I would like to ask, you are a cardiophysiotherapist are there. So in the COVID time, just boost up how we can go for the fight with this corona. How do we can increase our respiratory power?
So the COVID helped me to create one new technique for KCAT. So that I will introduce to you. That is a good idea. Sir, basically, during COVID time, I created a few posters to my clients. And as well as I worked in COVID also, working still. So in that, I understand that the vaccines may come. And we do not know how much it is going to be useful. The vaccine may come. I did not know how much it is going to be useful. All are theoretical now at present. And the second point is whole world is interested on creating vaccine rather than creating a medicine that I don't know. Because a problem comes, you give medicine. So how it makes means the people who are having a back pain is my patient. That is called medicine. Whoever having the back, all are my patient. So that is vaccine. So we do not know why the vaccine, they are all the companies are moving towards, and we are not considering about the finding out of medicine for this. That's other way to develop the debate. But here I decided that unless the new intervention of medicine is coming, the only way is create or boost your own immunity. So how you can boost up your own immunity as a physiotherapeutic perspective? Because the people, they give vitamin C and zinc is a very common tablet now. Everybody is taking. It's a more than the requirement of awareness has been created. Second one is washing the hands, right? And all these things everybody knows. So I want to talk few tips which is not relevantly talked by many people, right? The first one is what I believe means your body is beautifully having immune boosters every places. The very important immune booster. Whenever any bacteria or virus it comes, the first route of any translation is for droplet infection is first it is going to your throat. Throat is a vulnerable area because it starts with the upper respiratory infection. So this upper respiratory infection nearby, if it comes, once it get colonized, so nearby area, immediately who can send the troop at the border is thymus. So thymus only will activate first. Thymus only create T lymphocytes. Spleen will create B lymphocytes. So I can fight with my T lymphocyte people. So how to do the T lymphocytes activation? Very simple. In a day, 2 times, morning and afternoon. I'm not asking you to do it in the night because for a damn reason that night, if you create a T lymphocyte activation, that will improve your sympathetic parasympathetic. Because parasympathetic activity will make your body as a base, not as acidic. So when your body is in base, automatically you will have you can have fight with your virus beautifully. If you are acidic already, it is very tough. So you have to maintain your pH. So always I prefer that morning and afternoon, how to activate the thymus. Simple step. So being a cardiorespiratory therapist, my KCAT, all the workouts are based on cardiorespiratory. So here thymus, the simple workout is, so you know that this is our breastbone. So in the breastbone, if you see that, actually mammarium sterni is there. Just below the mammarium sterni, you have a thymus. Thymus is very superficial immediately to the mammarium sterni. So you don't want to do anything. Just you tap it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. That's it. 15 times and leave it. You will have a good diaphragmatic breathing and activation of your thymus, and this you do regularly in the morning and afternoon, twice 15 repetition. That definitely will help you to improve your T lymphocytes.
Thank you, sir. Thank you. We have taken up both the things, KCAT and along with the how to fight with the COVID. And thanks a lot, sir. मैं बहुत ही शुक्रिया करना चाहूँगा कि आपने अपना समय निकाला और इतनी अच्छे से knowledge को share किया. Thanks a lot, sir.
So really, I'm very thankful to the Rehabilitation Science Group. You are doing a great job for the society, and best wishes. And I think it should be knocking door for many people to understand our science beautifully. Apart from physiotherapists, other fraternity will also respect our science by looking into it. It is a great job, really. Dharam sir, really, you're doing an amazing job, and thank you for the wonderful opportunity. And
Thank
even
you, sir.
Arpit sir, thank you.
Thank you, sir. Thank you so much. It was really well explained and wonderful lecture. I really enjoyed, and hopefully everyone has inquiries. Thank you, sir. Thank you so much.
Thank you, sir. Thank you.
Thank you.
Thank you.